Insulin is produced by which cells in the pancreas? A. Beta cells. B. Alpha cells. C. Delta cells. D. Gamma cells. The correct answer is A. Insulin is produced by beta cells in the pancreas. Which hormone is released in response to low blood glucose levels? A. Insulin. B. Glucagon. C. Cortisol. D. Thyroxine. The correct answer is B. Glucagon is released in response to low blood glucose levels. What is the primary function of insulin in the body? A. To decrease blood glucose levels. B. To increase blood glucose levels. C. To regulate cholesterol levels. D. To control blood pressure. The correct answer is A. The primary function of insulin is to decrease blood glucose levels. Which of the following is a symptom of type 1 diabetes mellitus? A. Frequent urination. B. High blood pressure. C. Obesity. D. Insulin resistance. The correct answer is A. Frequent urination is a symptom of type 1 diabetes mellitus. In diabetes mellitus, what is the main factor contributing to hyperglycemia? A. Excessive physical activity. B. Insulin deficiency or resistance. C. Low carbohydrate diet. D. High levels of insulin. The correct answer is B. Insulin deficiency or resistance is the main factor contributing to high blood sugar in diabetes. Which hormone stimulates glucose uptake by cells? A. Insulin. B. Glucagon. C. Cortisol. D. Thyroxine. The correct answer is A. Insulin is responsible for stimulating the uptake of glucose by cells. What is the term used to describe low blood sugar levels? A. Hyperglycemia. B. Hypoglycemia. C. Hyperinsulinemia. D. Glycogenolysis. The correct answer is B. Hypoglycemia is the term for low blood sugar. Which of the following is a long-term complication of uncontrolled diabetes mellitus? A. Hypoglycemia. B. Diabetic ketoacidosis. C. Chronic kidney disease. D. Hyperinsulinemia. The correct answer is C. Chronic kidney disease is a long-term complication of uncontrolled diabetes mellitus. What is the name of the condition characterized by high blood sugar levels during pregnancy? A. Type 2 diabetes mellitus. B. Prediabetes. C. Gestational diabetes mellitus. D. Hypoglycemia. The correct answer is C. Gestational diabetes mellitus is a condition characterized by high blood sugar levels during pregnancy. Which hormone is released during times of stress and can increase blood glucose levels? A. Insulin. B. Glucagon. C. Cortisol. D. Thyroxine. The correct answer is C. Cortisol is released during times of stress and can increase blood glucose levels. What is the hormone produced by the alpha cells in the pancreas that raises blood glucose levels? A. Insulin. B. Glucagon. C. Adrenaline. D. Cortisol. The correct answer is B. Glucagon is the hormone produced by the alpha cells in the pancreas that raises blood glucose levels by stimulating the breakdown of glycogen in the liver. What is the term for the condition where blood sugar levels get too low, causing shakiness, confusion, and fainting? A. Hyperglycemia. B. Hypoglycemia. C. Diabetic ketoacidosis. D. Insulin shock. The correct answer is B. Hypoglycemia is the term for low blood sugar. This can cause symptoms like shakiness, confusion, and fainting. Which hormone is released by the adrenal glands in response to stress and can also increase blood glucose levels? A. Insulin. B. Glucagon. C. Cortisol. D. Thyroxine. The correct answer is C. Cortisol is released by the adrenal glands in response to stress and can increase blood glucose levels to provide energy for the body's fight or flight response. Which of the following is a potential complication of uncontrolled diabetes that affects the eyes and can lead to vision loss? A. Diabetic neuropathy. B. Diabetic nephropathy. C. Diabetic retinopathy. D. Diabetic gastroparesis. The correct answer is C. Diabetic retinopathy is a long-term complication of uncontrolled diabetes. It affects the eyes and can lead to vision loss if left untreated. What's the term for high blood sugar during pregnancy? A. Hyperglycemia. B. Type 1 diabetes mellitus. C. Type 2 diabetes mellitus. D. Gestational diabetes. The correct answer is D. Gestational diabetes is the term used to describe high blood sugar levels during pregnancy. It can pose risks to both the mother and baby if not managed properly. Which hormone promotes glucose storage as glycogen in the liver and muscle cells? A. Insulin. B. Glucagon. C. Epinephrine. D. Cortisol. The correct answer is A. Insulin is the hormone responsible for promoting the storage of glucose as glycogen in the liver and muscle cells, reducing blood glucose levels. What is the primary hormone responsible for lowering blood glucose levels in the body? A. Glucagon. B. Cortisol. C. Insulin. D. Epinephrine. The correct answer is C. Insulin is the main hormone responsible for lowering blood glucose levels by promoting the uptake of glucose into cells for energy production and storage. What's the term for the condition with insulin resistance, high blood sugar, and relatively low insulin? A. Type 1 diabetes mellitus. B. Type 2 diabetes mellitus. C. Gestational diabetes. D. Prediabetes. The correct answer is B. Type 2 diabetes mellitus is characterized by insulin resistance, high blood sugar levels, and relative insulin deficiency, often associated with lifestyle factors. Which organ is key to regulating blood sugar? It stores extra sugar as glycogen and releases it when needed. A. Pancreas. B. Liver. C. Kidney. D. Spleen. The correct answer is B. The liver plays a crucial role in regulating blood glucose levels by storing excess glucose as glycogen and releasing it when blood glucose levels drop. What is the term for a metabolic condition marked by high blood glucose levels without diabetes symptoms? A. Hyperglycemia. B. Hypoglycemia. C. Ketonuria. D. Prediabetes. The correct answer is D. Prediabetes is a metabolic condition marked by high blood glucose levels. In the absence of diabetes symptoms, it indicates an increased risk of developing type 2 diabetes. Which hormone helps break down glycogen to raise blood sugar during stress or danger? A. Insulin. B. Cortisol. C. Glucagon. D. Thyroxine. The correct answer is C. Glucagon is released by the pancreas to increase blood glucose levels by promoting the breakdown of glycogen in the liver. Which of the following is a characteristic of type 2 diabetes mellitus? A. Autoimmune destruction of pancreatic beta cells. B. Insulin resistance and relative insulin deficiency. C. Rapid onset of symptoms in childhood. D. Dependence on exogenous insulin for survival. The correct answer is B. Type 2 diabetes is characterized by insulin resistance in tissues and relative insulin deficiency, often associated with lifestyle factors. Which hormone does the pancreas release when blood sugar is high? This hormone helps cells absorb glucose and store it in fat. A. Insulin. B. Glucagon. C. Epinephrine. D. Leptin. The correct answer is A. Insulin is released in response to high blood glucose levels to facilitate glucose uptake by cells and promote its storage as glycogen or triglycerides. What is the term for a temporary rise in blood sugar after eating, causing insulin release to help cells absorb glucose? A. Hyperglycemia. B. Hypoglycemia. C. Postprandial hyperglycemia. D. Dawn phenomenon. The correct answer is C. Postprandial hyperglycemia refers to increased blood glucose levels after a meal, triggering insulin release to normalize levels. How does the hormone leptin contribute to the regulation of blood glucose levels and energy balance in the body? A. Promotes appetite and food intake. B. Inhibits insulin secretion from the pancreas. C. Increases glucose uptake by muscle cells. D. Regulates body weight and metabolism. The correct answer is D. Leptin is involved in regulating energy balance, body weight, and metabolism, influencing glucose homeostasis and insulin sensitivity. Which of the following is a risk factor for developing gestational diabetes mellitus during pregnancy? A. Obesity. B. Regular physical exercise. C. Family history of type 1 diabetes. D. Low pre-pregnancy blood glucose levels. The correct answer is A. Obesity is a significant risk factor for gestational diabetes, increasing the likelihood of developing temporary high blood sugar levels during pregnancy. What's the term for when your body's cells don't respond well to insulin, causing high blood sugar? A. Insulin resistance. B. Type 1 diabetes. C. Gestational diabetes. D. Hyperinsulinemia. The correct answer is A. Insulin resistance is a key feature of type 2 diabetes and can lead to elevated blood glucose levels due to decreased insulin sensitivity. Which hormone from the pancreas lowers blood glucose by helping cells, especially muscle and fat cells, absorb glucose? A. Glucagon. B. Cortisol. C. Testosterone. D. Insulin. The correct answer is D. Insulin is produced by beta cells in the pancreas. It promotes the uptake of glucose by cells, reducing blood glucose levels. What is the term for a group of metabolic disorders characterized by high blood sugar levels over a long time, due to problems with insulin? A. Hypoglycemia. B. Diabetes mellitus. C. Hyperglycemia. D. Metabolic syndrome. The correct answer is B. Diabetes mellitus refers to a group of disorders characterized by high blood sugar levels, including type 1 and type 2 diabetes. Which hormone helps break down stored glycogen into glucose to raise blood sugar when it's low or during stress? A. Leptin. B. Growth hormone. C. Insulin. D. Glucagon. The correct answer is D. Glucagon stimulates the breakdown of glycogen in the liver to release glucose into the bloodstream when blood sugar levels are low. Which hormone is released by the alpha cells in the pancreas to raise blood glucose levels? A. Insulin. B. Glucagon. C. Leptin. D. Cortisol. The correct answer is B. Glucagon is released by the alpha cells in the pancreas to stimulate the breakdown of glycogen into glucose, raising blood glucose levels. When does the body show insulin resistance, high blood sugar, and relatively low insulin? A. Type 1 diabetes mellitus. B. Type 2 diabetes mellitus. C. Gestational diabetes mellitus. D. Prediabetes. The correct answer is B. Type 2 diabetes mellitus is characterized by insulin resistance and relative insulin deficiency, leading to high blood sugar levels. Which of the following is a long-term complication commonly associated with uncontrolled diabetes mellitus that affects the kidneys? A. Diabetic retinopathy. B. Diabetic neuropathy. C. Diabetic nephropathy. D. Diabetic foot ulcers. The correct answer is C. Diabetic nephropathy is a common, long-term complication of uncontrolled diabetes that affects the kidneys. What type of diabetes can develop during pregnancy and usually goes away after giving birth? A. Type 1 diabetes mellitus. B. Type 2 diabetes mellitus. C. Gestational diabetes mellitus. D. Diabetes insipidus. The correct answer is C. Gestational diabetes mellitus can develop during pregnancy and typically resolves after childbirth. Which hormone, released by the pancreas when blood sugar is high, helps cells absorb and store glucose in fat tissue? A. Insulin. B. Glucagon. C. Cortisol. D. Leptin. The correct answer is A. Insulin is released by the pancreas to facilitate glucose uptake by cells and promote its storage in adipose tissue. What is the term for a metabolic disorder with high blood sugar levels over a long time because of problems with insulin? A. Prediabetes. B. Hypoglycemia. C. Gestational diabetes mellitus. D. Diabetes mellitus. The correct answer is D. Diabetes mellitus is a group of metabolic disorders marked by elevated blood sugar levels resulting from defects in insulin secretion, action, or both. Which hormone breaks down stored glycogen into glucose to raise blood sugar when it's low or during stress? A. Insulin. B. Glucagon. C. Leptin. D. Cortisol. The correct answer is B. Glucagon stimulates the breakdown of glycogen into glucose to elevate blood sugar levels in response to low blood sugar or stress. What is the term for the temporary rise in blood sugar after eating, causing insulin to be released so cells can absorb glucose? A. Hyperglycemia. B. Hypoglycemia. C. Postprandial hyperglycemia. D. Dawn phenomenon. The correct answer is C. Postprandial hyperglycemia refers to the temporary rise in blood sugar after eating, prompting insulin release for glucose uptake by cells.